All right, Paul. So this was episode number 436, Endometriosis with Doctors Isabel Green and Adela Cope, with production by Dr. Carolyn Chan. And Paul, start us off by telling us, what is endometriosis?
Such a great question, Matt. I would like to tell you. So endometriosis is what is the presence of endometrium-like tissue, not necessarily endometrium specifically, that is someplace where it does not belong. And that doesn't even necessarily have to cause symptoms. So you can have endometriosis and be asymptomatic. And that's one of the challenging things with this diagnosis, is that the presentation can be so variable. So I think we typically think of it as being sort of cyclic and occurring with menses, but even that is not necessarily the case. You can have pain in between menstrual cycles, and that does not rule out or make it the incorrect diagnosis. So Matt, remind me some of the symptoms that we can actually see with this that maybe should prompt us to start thinking about it.
Yeah, a lot of words that begin with the letter D. There's dyspareunia, so that's pain with intercourse; dyschezia, pain with defecation; there's dysuria, pain with urination; dysmenorrhea. So yeah, all those, Paul, can be part of it. People can have just vague symptoms like fatigue. And then, Paul, there's a lot of overlapping pain syndromes. Things like IBS, fibromyalgia, painful bladder syndrome can co-occur with this. And I'm not sure if that's because patients had endometriosis that's sort of